But vaccines, washing your hands, and taking care of yourself by not showing up to work sick, not sending your kid to school sick. Those bread and butter ideas of epidemiology over time are exactly what is our ticket to get out of this pandemic, and it's been working so far.
Old school common sense, right?
That's
Go back
right.
to basics. What else can we do different? So you mentioned that there's new technologies that you're implementing into the healthcare system. You talked about metal ions for water purification. We talked about UVC disinfection and driving, hand washing, hygiene, more PPE. What are we missing? Is there something else we should be looking at?
Well, I certainly think the common factor behind all of this is people, right? We need people to do a lot of these things. And so, there's a whole field of human factor engineering, which we use a lot when we talk about performance improvement and Lean Six Sigma. We need people to do these things. And so, how do we work our infection prevention interventions into a workflow of a nurse or a tech working with patients to allow them to do what we need them to do to protect themselves and the patient? I think that's really the thing that infection prevention has probably been missing for a long time, is that common sense of, yes, we know that a nurse needs to wear PPE and wash his or her hands and do all this. How do we make it really easy for them so that they can't miss it and it's not an impediment to their workflow? We all know there's a healthcare staffing crisis right now in our country. There's not enough nurses, particularly here in Florida with an aging population. So asking them to do more is a problem. It's going to interrupt their workflow and make it harder to do their jobs. And so, how do we as infection preventionists make their jobs easier and still allow them to do the right thing? I think that's the big coming flood of infection prevention methods in education.